First 30 minutes, we've got Dr. K, who has been a regular around these parts for a long time. I think it all started back in 2020 when COVID first came into the news. I called Dr. K, who had been a regular member of our cast on the program anyway, and asked if he would be willing to come on and talk about this thing for 2 or 3 weeks. Right, Dr. K?
That's correct. It's been a long time. Back then, we thought this would only last, 2 weeks, 3 weeks?
Yeah.
And it's still here, 3 years.
So. You are the founder and president of an organization called Health Watch USA. You recently had your conference and had speakers from literally all over the world. And one of those speakers you have with you today. I'm very excited to find out more. Tell us who that is.
Well, yes, we're privileged to have Dr. Nele Brusselaers. She is from Belgium. She works at the Global Health Institute. She's also a senior researcher and associate professor of microbiology, tumor and cell biology at the Karolinska Institute in Sweden. And she published just an excellent review into the Swedish strategy and COVID-19 response that was published in one of Nature's family of journals. And it's been very well accepted. And some of the really what I would consider misinformation that she talks about that was spread through her country during the response has actually spilled over into our country. As you know, Jack, many people on the show, many people in news media, they tend to use Sweden as the benchmark of what responses should be. Yet, as we'll hear from her, it may not be as good as what people say. The emperor may have no clothes. So let's turn it over to Dr. Brusselaers. I'm very excited to have her here.
Good morning, everyone. Thanks for the really nice introduction. So I've been living in Sweden for 8 years and also when the pandemic hit. And it was quite eye-opening because they were responding completely different than the rest of Europe and the rest of the world, while all the other countries were preparing. You know, when Italy was overflowing with COVID patients and all the hospitals were overwhelmed, Sweden was like, nah, it's never going to happen. We don't think it's going to come here. And basically, they were not really preparing. And they've actually been spreading quite some misinformation from the start. They were also the last ones to implement face masks. They've never really, isolated people when they had high-risk exposure. So they didn't even, they still didn't really admit that it's an airborne infection. So the main advice was throughout the pandemic, like, wash your hands. While if it's an airborne infection, washing your hands will not protect you against inhaling the virus. So, they were a bit slow. They are still slow in doing things to prevent the spread in society, and they didn't do that much. But one of the big advantages of Sweden, which many people seem to forget, is that it's such a huge country, only 10 million people. So, like, for example, if you compare it with Singapore has 5 million people in basically a big city, while Sweden is 1,500 kilometers long. Sorry, that's 1,000 miles, I think. So it's a very open country, small families, many single-person households. They're not the most social people as well. So they had a very good starting position. So they should have been at the best of the class, considering the number of infections, the number of deaths, and all those things. But somehow they weren't. So what else do you want me to say?
Dr. K.
Yeah, I think one of the biggest issues that we've had that we keep hearing from Sweden is that look at what they've done with their schools. They're open. Kids don't spread infections. We need to keep our schools open without masking, without improving ventilation, because kids are at low risk for COVID and they don't spread the disease. That's what I hear based on Sweden here in the U.S. And I'm wondering what your feeling is on whether or not children can spread infections, whether or not they were maybe, with herd immunity, how that's all intertwined. Maybe you could talk on that.
Well, kids, they can spread infections. Kids can get ill. That was one of the things that was also said in Sweden, like, kids cannot get ill. But there have been quite a few kids ending up in intensive care and also dying. So kids can become ill. But there are now, in the meantime, we have a whole series of things we can do to keep the schools open. We can vaccinate. There are also lots of adults in schools, the teachers, all the maintenance people. So if you can vaccinate them, if you can, work on infection control, put them in bubbles, that there's not mingling of all the kids all together, it's possible, especially if you vaccinate many of them. But that's also one of the things in Sweden that didn't really happen. And that's also one of the things in the beginning of the pandemic, when many countries in Europe were in lockdown. Then the upper high school, so the kids older than 16 and university, they were not. They were having distance learning. But the smaller ones, they were all in school, and they were not even telling the parents or the other teachers if there were cases in the school. So some of them may have had some infection prevention measures, but most of the schools seem to not have had any protection. And you were also not allowed to keep your kids at home if they were at risk. So if you ventilate a lot, if you put the kids more outside, if you try to limit the infection. Now, I think after 3 years, nobody wants to have the kids at home anymore because it's been just too long. But then there have been infections in the schools. There have been kids ending up in the intensive care. And with some relatively simple measures, you can reduce those numbers. And every kid who gets heavily ill is one too much, I think, in my opinion. Even if mortality is way lower in children than in grown-ups. But, you can also get the long COVID. And we don't know how long COVID will persist. But you don't want to have permanent organ damage or neurological damage in children, I would say. So it's not only the deaths.
Dr. Brusselaers, how did Sweden become sort of the benchmark or receive the publicity that it did regarding the handling of COVID-19 if they really didn't handle it all that well?
They have been in the media from the beginning. So for me, it feels that they've been promoting the strategy from the start. Mm-hmm. But yeah, in the beginning, I think they were also not that transparent, what actually was happening, how many cases there were. And also in 2020, the numbers were quite high, but it all depends on how you bring the message, I guess.
And what's the situation there now?
Well, it's autumn again, so the schools have, the new year started. So like in the rest of Europe, the numbers are slowly getting up again. But vaccination rates are less high than in, for example, Belgium. Here in Belgium, we had our 4th dose in the meantime, or people are getting the 4th dose. And there is also some resistance of getting vaccinated, not again. But in Sweden, it's also not really promoted. It's promoted for the 65-year-olds and older, but also for the younger people, the public health agency doesn't really recommend getting vaccinated. But it's still early of the autumn, but the cases will go up again, as in most of Europe, because of the weather changes.
Yeah.
Dr. K?
Yeah, I think if you look at Sweden's performance, comparing it to other Nordic nations, it has not done well. They have many, many more deaths, hospitalizations, and even new cases than their neighboring Nordic countries. And it's really a failed response, Jack. From what I understand, there was a big push trying to achieve herd immunity, which was pretty much an utter disaster. And some think they were using the children to try to do this. There's, some evidence to that, although nothing for sure. But I'm wondering if you could maybe comment on that also.
Yeah. So in the beginning, there have been emails. In Sweden, they have a law which obliged public officials to make their emails publicly available. And from the beginning, there were indeed emails from the state epidemiologist who stated, or that he was discussing, like, can't we use the children to reach herd immunity faster? And around the same time, he was saying publicly, like, kids don't get infected. And they never admitted herd immunity, that was a goal. They said, okay, maybe it will be a side product. But they never admitted that was their goal, which is also not, not fair, I think, towards the public. I kind of lost the rest of the question.
Our guest this morning is Dr. Nele Brusselaers, and we're talking about Sweden and their response to COVID. And we are back with Dr. K, Dr. Kevin Kavanagh, and also with us this morning is Dr. Nele Brusselaers, and you were sort of in mid-thought there, and I interrupted you there, Doc. Go right ahead.
Well, what I was saying is the disinformation is really a big problem. I think a lot of people in the United States started hearing that, in Sweden, schools are fine, kids don't spread the disease, herd immunity can be achieved, etc., etc. Well, Sweden's having spikes in cases, as with other countries, and has had that significantly. And you can go to Our World in Data and take a look at that. And it's, I think, very distressing. And this information was amplified by organized disinformation campaigns. For example, Jack, there's a number of articles out. I've read this in the Daily Beast, The Economist, and the Daily Mail. So there you have a left, a right, and kind of in the middle magazine talking about one of Putin's chief people called Putin's chef. I can't pronounce his last name, but he heads up both the Wagner's group and the disinformation campaigns in Russia, and he's been indicted with interference in United States elections. You also have a European Union document that was out early in the pandemic showing the disinformation from these organized players. These guys do not want to see the United States performing well in any degree anywhere. And getting us weakened by the pandemic and our response is one of their strategies. And so we have to take information and news media from multiple sources. I read a lot of foreign news outlets. I think you can't just center on one. And it's important to try to stay informed. But right now, there's an organized effort to get out disinformation because we're in a pretty good conflict right now in the world with Ukraine. And you've got to be really on your toes to try to figure out what's going on. So be careful out there. And I would definitely treat this virus seriously because of the risks of long COVID.
What is your question?
I completely agree with that. Yeah, I completely agree with that. And for me, the disinformation, especially from public health officials, was for me very disturbing because you think, okay, they are responsible for, infection control in the country, and they are the ones spreading the misinformation, and that's something that you saw in Sweden that you didn't hear about the international media. You only saw the media in Sweden, which was saying a different thing than what the rest of Europe was saying. So yeah, I give the ball back to Kevin.
Kevin, we got about 3 minutes left.
Yeah.
Go ahead.
Yes, well, I think right now with the pandemic, we are entering into a new stage. As you know, the hospitalizations are down, infections are down, but we still shouldn't let our guard down. As I said, we've been here before. You've got new variants over in Europe, and they're also over here in the United States, the BF7 variant, the BA 2.75 variant. And these variants are causing some concern. And yes, we do have enough immunity build up, whether it's natural immunity or through vaccination immunity, to ward off in many times the severe outcomes of hospitalizations and deaths. But unfortunately, more and more people are developing this entity called long COVID, which is starting to impact our workforce. So I do think that as a society and even as a country, we need to look at trying to mitigate spread of this virus. We're not going to eliminate it completely, but we do need to try to decrease the number of infections that people have and the exposure to the virus. Because, Jack, I think that everybody at this point has had a COVID-19 infection. The question now is, how many times are you getting infected? And with the winter months coming, I think we need to keep our guard up. And as I've stressed before, there's a new booster out for COVID-19. It's a bivalent booster. It incorporates the BA5 types of genomes, which should give you much better protection for these new variants. And boosters have been shown to prevent infections, to prevent hospitalizations, and also a number of studies show them to prevent long COVID. So let's go out and get a booster. Our booster rates in Kentucky are exceedingly low. And so we really do need to do that.
Dr. Brusselaers, thank you so much. We sure appreciate you.
Thanks for having me.
Time. You bet. And thank you, Dr. K, as always, sir.
All right. Thank you, Jack.